you guys, let me jump right into this video. It's me, Nikki, a glam underscore teacher. Let me jump right into this. This is most common questions asked about plastic surgery in the Dominican Republic, aka the DR. So, first question, what is the cost? Okay, the cost is going to vary. It's going to be based on your BMI, based on prior health conditions that you might have, and based on the procedure. So I'm going to go down a cost based on like me, a bigger person, and I have no prior health conditions. I am not a smoker. If you're a smoker, you might have like some type of extra fee. Because I am a bigger person, I have to pay, get like an insurance. It's an insurance fee, some type of extra insurance that I pay because my BMI is higher. BMI limits are going to vary by doctor, but for the most part, if your BMI is over 35, sorry, this is a whole different question, but if your BMI is over 35, then you probably should not be getting surgery. Honestly, you need to lose a little weight because the heavier you are, the more riskier it is. I mean, you might can get one procedure done, but nobody's going to flip over like this big 300-pound person. Like, come on now. Y'all got to be a little bit more realistically. It's okay to lose 20 pounds. Like, I don't know why people put up such a big issue about losing weight. I want to be healthy when I'm going under. So, I don't know. I don't know what y'all be getting this information from and be thinking those doctors are not magicians. This is your life. Your life. So I don't know how to help y'all figure that out, but lose some weight. Wait a couple months. It's okay. But back to the cost. So like lipo in a BBL is going to run you about $3,000 to $5,000 US. And this is just for the surgery. You need to also calculate your flight, your recovery house, your medical equipment that you may need, and things of that sort. So make sure you research all the costs and be prepared to pay the cost to be the boss. Tummy tucks gonna come with lipo, and BBL for the most part is included. Whether you want it or not, it's still going to be about the same price. So tummy tuck in a BBL is going to be anywhere from like $5 to, I would even say $4, because some doctors are a little like $4,700. So I would say $4,000 to $6,000, maybe even a little higher depending on the doctor. So when I say depending on the doctor, it depends on the doctor's skill level, the doctor's experience, the doctor's popularity, because doctors, honestly, because they're popular, they're going to charge more because they can do that. People are going to come because everybody is saying their name. People are going to come. But that's how much that's costing, between about 4, 6, 7,000. There you go. It can get expensive. And remember, they don't accept credit card. Okay? Cash. Health insurance, your US, Canadian health insurance is not going to work over there, sis. Bro. Ooh. Breast procedures, like a breast lift is going to be, or reduction, like a breast lift and lipo is going to run you anywhere from $3,000 to $5,000. Next question. How long to stay? Again, how long to stay, that depends on what procedure you're having and you. I've seen people literally tell their stories and say they got surgery and like 2 days later they had to rush home because of a family emergency, or they just missed their family so much, or whatever the case. And I mean, some people worked out. Other people may have came home early because they had an infection and didn't feel like the DR could, handle it. So they wanted US doctors to work on it. I would recommend staying in the DR because, certain bacteria and stuff are known in the DR and they have the treatment and stuff to already, work on fixing it there, versus you coming back here and the doctors here like, we've never seen anything like this. We don't know how to treat it. Because I got it in the DR. I don't know why y'all run. Sometimes it's for the better. Don't give me, sometimes it's for the better. Like, there's so many different situations. But once again, do what's best for you. Do your research and you will be okay. Tummy tuck procedure, how long to stay? So in my opinion, most doctors are telling you 14 days. I would say 3 weeks. Like, what's that, 21 days? Yeah. I would say that because you really cannot move too much. There's not much you can do. You can't bend, you can't lift heavy items. You're going to be sore and uncomfortable. So when you're over there and you find a good recovery house, those people are going to wait on you hand and foot. So I'm going to pay for them to take care of me, because when I come back here, I'm not going to have a lot of help. So the longer you stay, I think the better your outcome will be, your results. And then getting massages after your surgery, that's going to cost a lot here. A massage there is going to be about $20 through $30, and it's going to do you good. A massage here is going to be anywhere from $50 to $120, and it may not even be that good of a massage, and you might need to get drained with a needle. They're not going to do that here for the most part. So stay over there a little longer. It won't hurt for an extra 3 to 4 days. You're going to miss your family, but it's for your health and for better results. You didn't pay all this money. Make sure you're going to have good results. Okay? Just chill out. How to prepare. So my best advice on how to prepare: just be calm. Don't rush it. Take your time in deciding everything. Like, consider all factors. Talk to people that have actually went or that have done extensive research. And when you're talking to these people, don't just talk to anybody. Talk to somebody who is getting the same procedure as you, or has had the same procedure that you're planning to get. Talk to someone who has the same body type as you. Talk to someone who has been to the doctor that you also want to go to. Okay? And if any of y'all are considering Cabral, Yealy, Robes, or Minion, y'all can, drop comments. Some information I won't really feel comfortable with putting publicly on YouTube, but if that's the case, I will let you know. Hey, send me a private message on Instagram. My Instagram is going to be glam_teacher. And also make sure you like and subscribe to my channel. Okay, make sure y'all hit that subscribe button, please. But yeah, if y'all looking at those 4 doctors, I have done a lot of research with them over the last 4 to 5 years, and I'm open to sharing my research and thoughts and opinions about those 4 doctors. Okay. Excuse me. Do I need a passport? Yes. If you're going anywhere out of the US or US territory, you do need a passport, unless you're going to the Bahamas. If you're going to the Bahamas, you just need your birth certificate, but we're not talking about the Bahamas. We're going to DR. So if you are going to the Dominican Republic, you do need to get your passport. How do I get a quote? So you can get as many quotes as you want. It doesn't just have to be, okay, I finally decided on this one doctor, let me get a quote from them. No, actually your quote should help you in making the decision about the doctor. Now, don't say, oh, well, this doctor quoted me $4,000. This doctor quoted me almost $7,000. You have to look and see what exactly is quoted in your quote. Now, I know Cabral, he is just going to quote you for the surgery. So it might look like, why this is kind of low? Because he's not going to include recovery houses and a lot of other stuff. So you need to make sure you're understanding what your quote is and ask the assistants questions. Some quotes will include, make sure the quote is detailed. Okay, just make sure it's detailed. If you just get like some type of basic quote, I wouldn't even want to go to that doctor. You didn't even have, you didn't even want to give me some detailed information, like, you want me to trust you with my life? No. So make sure your quote is detailed with the price, what it includes: liposuction of the back, the flanks, tummy tuck, muscle repair, hernia repair. You need to let them know when you're sending your pictures. Okay, so you're going to send pictures, and this is going to be on WhatsApp or email. If you don't have WhatsApp downloaded on your phone, it's an app. It's called WhatsApp. You need to get WhatsApp on your phone. And you're going to send pictures of you standing naked, standing straight, boom. Turn to the side, boom. Turn to the back, boom. And then the next side, boom. Take pictures like that. Don't be sucking it in and trying to, no, just send those pictures regular so the doctor can really examine what they need to do. If you know that you need a hernia repair, let them know, I need a hernia repair, or I have some type of blood disorder. Let them know. Be open and honest so you can get a clear quote. That way when you get over there, there's no big surprises. Let them know I'm a smoker, or I didn't have 5 C-sections. Let them know, because it's going to be critical in how much it's going to cost. It's going to be critical in what the doctor can and can't do. And you just want to know things up front so you can decide if this is the doctor you want to go with or not. So you send your quote to WhatsApp. They're going to send you back a questionnaire. Fill out that questionnaire with your pictures, and get the information back. And it should be detailed. It should tell you what to do before surgery. Excuse me. It should tell you what you should do to get prepared for surgery, what airport you're flying into, and that airport should be SDQ. It should also tell you if recovery house is included in that, and what recovery houses you can choose from if you can. Most quotes do include like a couple massages, your first garment, like the garment you're going to wear out of surgery. It might include some basic supplies, but go ahead and get those quotes from doctors, okay? And be patient, because there's a lot of people going, and don't think you're gonna send a quote and 20 minutes later you're gonna get it back. Some doctors you may, but it's not gonna always happen like that. Do I need a surgery sister? I kind of think no, because when you get to the recovery house, you're gonna meet so many other girls there. You actually might meet a surgery sister on the plane going there. You gonna tell who kind of going there for what you going there for, But or you might meet somebody off of Instagram that's going to the same doctor around the same time. Nothing is wrong with just introducing yourself to the person, but don't fully trust these people, because you guys are still yet strangers to one another. I would advise bringing like a partner, a friend, but a lot of people do go by themselves, and that's okay too. It's not like crazy scary over there. I've been to the Dominican Republic before, and it's not bad. It's not at all. But always watch your surroundings. They have those lockbox fanny packs that you can wear on you. Hide your money in your breast and other ways. I'm not going to say how you can hide your money. You never know who's watching and reading and plotting, okay? So be careful when y'all putting out information on public platforms. Like, I'm not going to tell y'all what doctor I'm going to, what day I'm having my surgery, or any of that, because some things should be private, because you never know who's watching and plotting and creeping and peeping, okay? Y'all never know. But if you do get a surgery sister, that'll be nice. But it's not necessary. Like I said, you'll meet people at the recovery house. What is the process like? I see that. Oh yeah, I see this a lot too. So the process, from what I have been told by people that have been there, is that you arrive there, you get off the plane. Before you even arrive, make sure everything is confirmed. You paid your deposit. You'll pay your deposit through Zelle. Not Zelle. You can do Zelle, Western Union, PayPal. Doctors do it in different ways. Deposits come in different prices depending on doctor. For the most part, anywhere between $200 and $500 is going to be your deposit to lock in your date for surgery. And then 2-3 days before you actually fly out, you should be receiving confirmation from your doctor, the doctor staff, the recovery house, your driver. And when you get to the airport, you're going to link up with the driver from the recovery house or whoever. They're going to take you to the clinic. You'll do your labs. Nowadays, you have to do a COVID test. And it really depends on what time you get there too. Like if you get there late at night, then you're going to go to your recovery house first. And then for the most part, you go do your labs and stuff. Then you go back to the recovery house. You unwind. You might eat, talk, go to sleep the next day. Go back to the clinic, get your results, get marked up, take your pill, go to sleep, get surgery, wake up in a recovery room. Hi, a lot of people wake up and they cold and shivering. Some people wake up throwing up. It really depends how your body responds to the anesthesia. Then you spend the day for the most part or overnight at the clinic. And then once everything is good, they'll take your vitals. When you're good, you go back to the recovery house, and that's where your recovery starts, right there. So make sure you're picking a good recovery house, a credible recovery house, because that's the real part right there, recovering. Recovery is not easy. I hear the first 3 days are the hardest, and that brings me to the next most commonly asked question. Can I bring my own pain pills? I would recommend no, but if you've had surgery before and you know your body, you've taken pain medicines and you ran this across your doctor, then maybe yeah, but make sure you're advising your doctor in everything you do. Get the okay from your doctor first. Remember, I am not a medical professional, so you can take the advice that I give you, but you need to consult a medical professional because it's not me, sis. Okay? Don't come glam teacher. Nah, baby. Glam teacher ain't said that now. Okay? All right. So, for me, I'm gonna take ibuprofen 800 and Tylenol arthritis, and I'm also going to take Benadryl. Benadryl, I hear, helps with a lipo itch, and it will help you sleep as well because you're going to be uncomfortable. So that is what I'm taking for pain management. And I'm going to definitely triple check with my doctor to make sure that ibuprofen is okay and it's not going to interact with whatever anesthesia that I've had. So, bam. I've heard that a lot of women in the past have taken perks, and Percocets interacted with whatever the anesthesia pain medicine you already got during surgery, and that has caused quite a few deaths. So please, please, please be careful with taking your own medicine. Okay? Please be careful with that. All right? I'm so serious. Please be careful with that. My next question is when to stop smoking. You need to stop smoking 4 to 6 weeks before surgery. The sooner, the better. And if you are a smoker, hookah, cigarettes, all of that, you need to stop smoking ASAP. And I advise for you to do the oxygen chamber treatments, the oxygen chamber treatments. Some recovery houses have it. They have an Oxyvita place where you won't have to pay the driver to take you there. That's not included in your package, but the driver will take you there and you do those treatments. It's like you're in a tank. You know, like when you go get an MRI and you go in that tube laying down. Like, okay, so you can go into a chamber of oxygen, and that helps you heal faster because smoking takes away like from oxygen and you healing up properly. And if you if you know your skin keloids, definitely go do the oxygen chamber at least once before your surgery and then a couple times afterwards. They're about $75 per session, and it should be about 45 minutes to an hour that you are in there. Yeah, it starts at about $75 to $100. If your recovery house offers it, try to see if you can work some type of discount with them. Bada boom, bada bang. When to start massages. Once again, listen to the advice of your doctor. If he's saying no massages the next day of the surgery, don't do it. Okay? Don't do it. Most people by the third day, you're getting massages. Okay. There you go. Do I need an overnight nurse? Yes, you definitely do need an overnight nurse, especially one that translate that knows English and Spanish. Because like I said in a video before, after surgery, when you are in recovery, um, the nurses at the hospital, like they're busy doing other stuff. And I hear honestly, Americans are ignored. Americans are ignored. And especially if you don't speak Spanish, they don't know what you're saying. You might say, help, help, help. They don't know what you're saying and what this means. So in Spanish, help is ahora. No, ahora. Ayuda is A-Y. Iota? Iota is stop. Or is it para? Y'all, I didn't forgot about my Spanish art. Anyways, y'all need to figure out them words. Y'all need to figure out help, I'm in pain, stand up, sit down, call the doctor. Yeah, you figure those words out before y'all go down there. Make a list, put the Google Translator on your phone, okay? Make sure your cell phone service is going to connect down there in case you don't have Wi-Fi because it can be in and out. Be prepared for every little thing. You need a overnight nurse. Okay, so they can help you when you wake up. If you cold, they can get you some blankets. If you throw up, they can help clean you up. You know, that is your protector right there. You're at your weakest moment. You need to research the proper overnight nurse for you. Don't get no nurse that's known to be sitting there on her phone, not paying no attention to you. No, get somebody that's actually certified that notices, oh, your eyes look a little discolored, that means X, Y, and Z, let me go get you help. Okay, you need an overnight nurse, and most overnight nurses for 12 hours I believe is $100. Pay that woman because you need her. Okay, don't go down there with no money and penny pinching them people, especially them people that's really coming through and helping you, that's there for you and trying to have your best interests at hand. This is your life. Don't play with your life. Why do people get multiple rounds? So people get multiple rounds because it's safer that way. Like, come on now. Like, who's gonna, I mean, I know they do mommy makeovers, which is your breast, your stomach, and lipo. But those are for people with a BMI at like 33, 30. They're healthy and physically fit, no heart problems, not a smoker. But for the bigger people, I mean, I just would not risk getting all of that done at one time. That's a lot of trauma on your body. That's a long time that you have to be under anesthesia. And it's not recommended to be under anesthesia long. So you need to make sure that if you need to get 2 rounds, you get 2 rounds. Nothing is wrong with healing, recovering, stacking your money up, and coming back 8 months later. Okay, some people just have a certain look that they want to achieve, and the first or second round is not going to cut it. So they may need a 3rd round. People get multiple rounds because they want to. Like, why do y'all be in people's business? Like, these questions I got from the surgery groups on Facebook, Instagram, Real Self. People ask these same questions over and over and over and over and over. And I know people are tired of answering them, and people just coming in and demanding information. Tell me this and tell me that. No, sis. Do your research. Use the search bar and figure out what it is. Watch YouTube. Y'all came across this video. I appreciate y'all so much. Ask me some questions in the comments if I didn't answer it. You know, let me know what else I can help you with, because this is life-changing and you want to make sure that you're prepared for this moment. You want to be prepared, y'all. Like, I'm just so happy for this experience. So make sure you're getting prepared for these moments. Go ahead and subscribe to my channel because I will have some more surgery related videos coming out. I am going to vlog my surgery experience and post it on here, so be on the lookout for that. Yeah, peace out. Take care, y'all.